All right. Make sure that you guys are using these little circles because they do help. Okay, they do help. Just writing things in sometimes for me, it it makes me think about it. It's not just reading it. When I write it, I kind of have to sit there and process the information a little longer. So quality improvement cycle is very important. All right, it's very extremely important for the NCLEX. They can give you guys a drag and drop or a select all that apply. All right, you have to know the quality improvement cycle. Okay. All right, so let's do the steps in the improvement process. Okay, let's do it together. Steps in the quality improvement process. A standard is developed and approved by a facility committee. Standards are made available to employees by way of policies and procedures. Quality issues are identified by staff, management, or risk management department. An interprofessional team is developed to review the issue. The current state of structure and process related to the issue is analyzed. Data collection methods are determined. So now let's talk about quantitative methods. So quantitative, think about quantity. So now we're counting. Quantitative methods are primarily used in the data collection process, although client interview is an option. Data is collected, analyzed, and compared with established benchmarks. If the benchmark is not met, possible influencing factors are determined. A root cause analysis can be done to critically assess all factors that influence the issue. And then our root cause analysis focuses on variables that surround the consequence of an action or occurrence. It is commonly done for sentinel events, client death, client care resulting in serious physical injury, but can also be done as part of the quality improvement process. Quality improvement process. Investigates the consequence and possible causes. Analyzes the possible causes and relationships that can exist. Determine additional influences at each level of relationship. Determines the root cause or causes. Potential solution or corrective actions are analyzed and one is selected for implementation. Educational or corrective action is implemented. The issue is reevaluated at a pre-established time to determine the efficacy of the solution or corrective action. So let's recap. So you have your performance improvement, quality improvement. This is your NCA guidelines. So whenever you see a guideline, you know that it's a possibility that they can test you on this certain material during your NCLEX or your exit exam. And believe me, if you're taking the exit exam, it's there. Performance improvement, quality improvement is on the exit exam. So these are the items that you are responsible for. This is the quality improvement cycle. I put circles here for you so you can write it in. You know, you have to do it. Read it, and then write it. Write it over and over and over again until you feel comfortable. And then the steps in the quality improvement process, I would make at least 6 copies of this page alone and read it and write it. Read it, write it, read it, write it. The beauty about it is it doesn't change. All right, it's not going to change. So if they give you a select all that apply, guess what? Boom, boom, boom. If they give you a drag and drop, boom, boom, boom. You've done it 10 times. The quality improvement process isn't going to change. And then a root cause analysis is something that we don't even discuss when we're in nursing school. It's like very rare that we have a lecture on root cause analysis, but it is important. So as a nurse, as a first year nurse, you're going to have a situation where a root cause analysis is required. So they will give you a question on root cause analysis because all first year nurses are going to encounter some situation where a root cause analysis is required. So the NCLEX is fair game on the NCLEX. So for 128, it's a big topic. I would make at least 10 copies of it. Do it over and over and over again. That's how you conquer that. All right, so referrals. Referrals is also a part of your NCLEX. It's on the NCSBN test plan. So referrals. Assess the need to refer clients for assistance with existing or potential problems. Assess the need for referrals and obtain necessary orders. Identify common resources for clients like respite care or social services or shelters. And identify which documents to include when referring a client, like medical records or referral form. So as a nurse, as a first year nurse, we can initiate a referral, and it's on the NCSBN test plan, so it's testable. All right. For your exit exam, the biggest thing when it comes to referrals is knowing what each member of the interdisciplinary team is responsible for. And guys, you know, as a nurse, you never send a patient home without oxygen, without if they have an NG tube. Don't send the patient home if they don't have the formula for the NG tube. Okay, if a person doesn't have oxygen, the patient doesn't get discharged. So just keep that in mind. And we can, in NCLEX world, in a theoretical world, we can initiate home modifications. So if the patient needs a ramp or the patient needs some type of a shower, sometimes the patient needs a bigger shower. As a nurse, we are allowed to initiate referrals for home modifications in the theoretical NCLEX world. All right, so look at the worksheet here. Take a few seconds. I'll make it a little smaller, but I know you guys have a copy. Think this is the patient referral form, and look at all of the requirements for this patient referral form. All right, take a look. Take like 2 minutes to look at it. All right. So let's break down this referral form. So there's a medical social worker. MSW is a medical social worker. So that comes into play if, let's say, if a patient needs medications, basically. They have to have a medical social worker. And look at the prescriptions, medical, IV, medications, injectables, additional information like allergies, flu vaccination, if they had the pneumonia vaccination. So make sure that you guys take a look at the patient referral forms. You can get a question on this. We are studying for the NCLEX, so any little tip or any extra studying is not going to hurt. All right. Oh man, guys, we're done. That's it. All right. So that's that. Okay. That's management of care. So some of you guys were not here the first day. So let's go back and just start from the first day so you guys will have those answers. For everyone else, you're all set. You're all set. You have read pretty much the entire leadership book. That's it. There's nothing else. There's nothing more. There's nothing less. So what we did, we took the NCSBN test plan and we broke it down word for word. So those are the questions that you'll get on the NCLEX. Of course, they're going to add laboratory values, vital signs, patient scenarios, but that is your foundation. Okay. All right. So just a second. So that way, that's very good. This way I can answer some of your questions that you may have. Hold on a second. Let me take you off mute. Oh, well, first, let's do the first part together first. All right, so let me know when you guys are ready. We're going to start from the beginning. Let me know when you're ready. Because I know some of you guys missed the first day. Yes, I can send the link to my YouTube channel. Yes. Guys, if you make sure that you like and subscribe to my YouTube channel so you can get the notifications when I go live so you won't miss me ever. If you subscribe to my YouTube channel and you send me a friend request on Facebook, you'll pretty much get everything that I do during the week. Either it'll alert your phone, Facebook, I'll be on Facebook Live, so you'll know I'm on live. If you miss it from Zoom, you can catch me on the live on Facebook. So make sure that you're on my Facebook and my YouTube channel. All right, guys, let me know when you're ready. We're gonna start from the top. Are you guys ready? All right, perfect. Let's go. So advanced directives, self-determination, life planning. So as per NCSBN guidelines, assess client and or staff member knowledge of advanced directives, living wills, healthcare agency proxy, power of attorney for healthcare. Integrate advanced directives into client plan of care and provide client with information about advanced directives, self-care, determination, life planning. So the very first topic for management of care, according to the NCSBN, is the advanced directives. Okay. Advanced directives, self-determination, life planning. Self-determination means that the client has rights. So we know everyone has a family, but we're there for the client. All right, so the purpose of advanced directives is to communicate a client's wishes regarding end of life care should the client become unable to do so. So, communicate a client's wishes regarding end of life care. So, 2 is CPR, 3 is feeding tubes, 4 is mechanical ventilation. So 2 is CPR, 3 is feeding tubes, C is mechanical ventilation. So the purpose of advanced directives is to communicate a client's wishes regarding end of life care. Does the client want CPR? Does the client need feeding tubes or want feeding tubes? Does the client want mechanical ventilation? So the client's decision is respected in regard to the use of antibiotics. This is initiation of diagnostic test. Initiation of diagnostic test. Provisions of nutrition by artificial means. This is a doozy. Provisions of nutrition by artificial means. And it's just that exact, it is just that precise, because as a nurse, we have to know if the patient wants any of these life-saving measures. The answer may be no, and that is okay. All right. 6, this is a big one. Patient Self-Determination Act. Patient Self-Determination Act requires that all clients admitted to the healthcare facility be asked if they have advanced directives. So I put a little patient admission form here, and it says it will make sure that the patient has like advanced directives. If they don't have advanced directives, they're going to send a representative in, or you have to discuss advanced directives with the client. It's non-negotiable. An advanced directive is a physician's order. An advanced directive is a physician's order. Unless a do not resuscitation or allow natural death prescription is written, the nurse should initiate CPR when a client has no pulse or no respiration. No pulse, no respiration. So remember, your guys, CPR is on the NCLEX, CPR is on the exit. So it's time to refresh. This is a little alert for you. Time to refresh on your CPR. All right. 9, a healthcare, oh, I'm sorry. 9, the nurse should ensure that the advanced directives are current and are reflective of the client's current decision. The nurse should recognize that the client's choice takes priority when there is conflict between the client and the family, or the client and the provider. The client's choice takes priority. The written prescription for a DNR or A&D must be in place, and the client's medical record. Client's medical record. The provider consults the client and the family prior to administering a DNR or A&D. So here is a Florida Advanced Healthcare Directive. And it's huge in Florida, guys. And it's a part of your management of care. So there you go. So what happens if a client doesn't have advanced directives? So a client who does not have advanced directives must be given written information that outlines their rights related to health care decision and how to formulate advanced directives. How to formulate advanced directives. Sorry, guys, this is formulate. Formulate. Sorry, guys. All right. Oh my, why did I do that? A healthcare representative should be available to help with the process. So a healthcare representative should be there to help, but if not, you're there. You have to explain. You can explain what an advanced directive is. You can't sign it like you're not the physician, but you can explain what what an advanced directive is, and you can talk to the patient about CPR, mechanical ventilation, and tube feeding. Okay. A living will, 15. A living will is a legal document. Okay. It is a living will is a legal document. It is a legal document. So it's nothing that you want to mess around with. It is a living document, a legal document that expresses the client's wishes regarding medical treatment in the event the client becomes incapacitated and is facing end-of-life issues. So it's something that you want to know. So examples of treatment are addressed. So A is cardiopulmonary resuscitation. And I want you guys to write it out. Cardiopulmonary. That means heart and lung resuscitation. That means it stops. It ceases. Cardiopulmonary resuscitation. Mechanical ventilation is addressed. And feeding by artificial means. Feeding by artificial means is addressed. Feeding by artificial means. Some patients do not want a PEG tube. Some patients don't want artificial feeding. 17. Most state laws include provisions that healthcare providers who follow the healthcare directive in a living will are protected from liability. So if let's say, for instance, the DNR is at home, well, someone needs to bring the DNR in right away. Now, a durable power of attorney for healthcare proxy is a legal document that designates a healthcare surrogate. Healthcare surrogate. That's the individual who is authorized to make decisions for the client when the client is unable to do so. So I know that quite a few of you guys know or you have worked as a CNA. So I'm searching that you have had to encounter a healthcare proxy. Correct? So that person, as you know, can make the decision for the client. All right. The person who serves in the role of a healthcare surrogate to make decisions for the client should be familiar with the client's wishes. So if they're going to make decisions, they should be familiar with the client's wishes. So if she is going to be her healthcare surrogate, she needs to know what she wishes. Does she want CPR? Does she want mechanical ventilation? Does she want artificial feeding? A durable power of attorney for healthcare as an adjunct to a living will can be more effective way of ensuring that the client's decision about the healthcare are honored. So the adjunct, this is the adjunct. Of course, it's better to have a person describing what the client wants as opposed to a sheet of paper. Now, they should reflect the same thing, but it's good to have an adjunct here. It's good to have her here. All right, so this is an example of an advance directive. So this is the advance directives. This is something that should be at every healthcare facility. But what I want you guys to look at it, when you get a chance. But you see, there's a witness. We are allowed to witness the advance directive. But it's better to have someone else involved. But don't worry about this for now. The physician's signature is what I wanted you guys to really focus on. All right. In order for this advance directives to be valid, it has to have a physician's signature. All right. It's an order. We take orders. So if the patient wants to be a DNR, we have to get the physician's signature. All right. Advocacy. Point 2. We definitely advocate for all of our patients. The board wants you to advocate for the patients. So they're going to ask you questions about it. So there's 4 topics when it comes to advocacy, treatment options. And it's mostly, when it comes to advocacy, it's like respecting the client. So we're there for the client. Our goal is to make sure that the client is respected. We're the voice for the client. All right. So how can we advocate for the client? What are some ways that we can advocate for the client? The nurse should seek the assistance of a medical interpreter or an interpreter. All right. A medical interpreter, guys. All right. That's one way that we can advocate for the client. When the person given the informed consent is unable to communicate due to a language barrier or hearing impairment, a trained medical interpreter must be provided. Many healthcare agencies contract. Okay, they contract with professional interpreters. So most of these agencies, guys, they have an interpreter line. Okay, now the doozy. The goal is, let's talk about case management now. Case management. Case management focuses on managed care of the client through collaboration of the healthcare team in an acute and post-acute setting. So this is the case manager. She's in the middle, and look what she's doing. She's improving the client outcome. She's advocating for the services this client needs. Good inpatient care. Making sure the patient receives good patient care. Medical solutions through biopharmaceuticals, making sure the client gets the medications, the oxygenation, helping to manage financial needs and diminish prescription errors. So case managers are responsible for the continuity of care and to ensure the client is receiving safe, quality care. And I want you guys to really focus on the goal of the case management is to avoid fragmentation of care. So it should be fluid. The care should be fluid. So fragmentation of care and control of costs. A case manager collaborates with interprofessional healthcare team during the assessment of a client's needs and subsequent care planning. So subsequent care planning. So what does that mean? That she collaborates with the interprofessional. She's going to collaborate with the physician while the patient is in the hospital, and she's going to collaborate with the physician if the patient is discharged. So subsequent care planning, and follows up on monitoring the achievement of the desired client outcomes within established time parameters. So the case manager collaborates with the interprofessional healthcare team during the assessment of a client's needs and subsequent care planning. Follows up by monitoring the achievement of the desired client outcomes within established time parameters. So a case manager can be a nurse, a social worker, or designated healthcare professional. It can be just a designated healthcare professional. A case manager's role and knowledge expectations are extensive. They know everything. They can tell you where to go, when to go there, what to expect. So a case manager role and knowledge expectations are extensive. They know a lot about the community. Case managers usually oversee a caseload of clients who have similar disorders. So let's say, for instance, she may be working with clients who have neurological issues, or she may be a case manager for cardiovascular clients who have cardiovascular disease. So similar disorders. All right. Clients, case managers in the community coordinate resources and services for clients whose care is based in a residential setting. So there's case managers in the community, guys. All right, so the doozy: assignment, delegation, supervision. Okay, this is a long subject area. So let's just take a little 10-minute break.